Okay, we'll go ahead and begin now. Okay. Good evening and welcome all to tonight's webinar series brought to you by the Mount Sinai Hospital, Marie Josie and Henry R. Kravis Center at 85th Street. I am your host, Frank Vera. Tonight, as our guest presenter, we have Rachel Kaplan presenting her topic in mental health titled Scanxiety, Coping with White Coat Syndrome. Rachel is a licensed clinical social worker at Mount Sinai Hospital, working on the left ventricular assist device and heart transplant team. Rachel has been working at Mount Sinai for over 5 years and has worked in the cardiac intensive care units, regular cardiac floors, and leading a support group in the outpatient cardiac rehab program. She is also a therapist in private practice in Manhattan, working primarily with adults facing chronic illness, anxiety, and depression. Rachel is certified in cognitive behavioral therapy, as well as palliative and end-of-life care, and is experienced in mindfulness, chronic illness, and the mind-body connection. Before we get started, I'd like to remind everyone that this is an open discussion webinar, and we will answer any questions that come in throughout the discussion tonight. We also ask that you please fill out the survey that will be prompted to you at the end of tonight's discussion. With that said, thank you all for joining us, and Rachel, the room is all yours.
Okay, thank you. Hi, everyone. Thanks for coming. So tonight we're going to talk about Scanxiety and white coat syndrome, two terms that I'll explain a little bit more a little later. But I wanted to start with just telling you why I decided to talk about this topic tonight. I've been presenting here at these webinars for a couple of months on different topics relevant to mental health and going through something with your physical health that all of you are here for. So, just by being part of the cardiac rehab program or coming to this webinar tonight, I assume that everyone attending either has recently been diagnosed with a new cardiac issue or experienced a medical event or has some kind of chronic condition, or maybe is a family or a friend or a loved one of someone who falls into one of those categories. And last month, I talked about some of the common stresses and emotional challenges that people face when they're living with chronic illness or adjusting to a new diagnosis. And other presentations that I gave, I talked just more broadly about mental health in general and anxiety and depression, which are very common emotional experiences, people who are facing one of these challenging health-related situations. And I talked about different strategies for how to cope with all of this. And so while tonight I am going to talk about these two terms, Scanxiety and white coat syndrome specifically, and how they relate to all of this, I'm also going to just sort of tie together all of those themes that we've been talking about the past few months and just how to cope in general with what you're going through, both in relation to the anxiety associated with doctor's appointments and tests, which is more what this topic is tonight, but also which could be used with just facing and coping with health conditions in general. So first I'll talk about what these terms mean and how common they are for people coping with chronic illness or a new diagnosis, and some tools and skills for coping with the distress caused by this anxiety. And again, if you've been to any of the webinars that I've presented at before, some of the things I discussed tonight and the techniques that I present will be some review from previous webinars, but I think are very relevant to this topic too. So I'm going to use a mix of some cognitive behavioral techniques, kind of challenging the way that we think when we're anxious, some mindfulness and breathing techniques when we're really feeling that anxiety in our body. And I'll talk about that in relation to Scanxiety and white coat syndrome, but also sort of anxiety in general. So that's what tonight will look like. So what is Scanxiety? What does this term mean? Even just from hearing that word, it might seem sort of obvious in the name itself what it means. And what that relates to is the anticipation and the anxiety that's experienced before a medical test or a doctor's appointment. So just hearing that, a lot of you may really identify with that. I think a lot of us feel that depending on what we're going to see a doctor for, what we're getting a test for. But for some people, perhaps you are someone who generally feels like you are getting sort of a good handle on how to cope with your health condition or diagnosis. Maybe you've adjusted a bit, sometimes can kind of put it away and compartmentalize it. Maybe you're someone who still is having some trouble adjusting to the fact that you have a cardiac issue and it's still very much in the back of your head or something you think about daily, but you have found a way to sort of live your life and make accommodations and you're still processing all of this. So whether you fall into one of those categories or not, oftentimes when a doctor's appointment or a medical test is approaching, suddenly you do feel more anxious, more overwhelmed. Those feelings of helplessness and fear come up, things that maybe you felt when you first were diagnosed or right after you had a medical event, or for whatever reason that brought you to cardiac rehab or to this presentation tonight, or feelings that you have on days that are just more difficult. And so I imagine that's something that everyone here tonight has felt at some point. Maybe didn't know there was a word to describe it, the Scanxiety. And this is a term that if you look it up, there are articles and things on that, but it's a term that I really like when I learned the language for it, just to describe this phenomenon of feeling really anxious and overwhelmed as a medical appointment or a test or a doctor's appointment is approaching. And part of why I'm using these terms tonight at all and named this webinar this topic is because I think having the language and the name for some of the things you may be feeling oftentimes can be really comforting and really validating, both in knowing that you're not alone in feeling this way and that this is really normal and really appropriate with what you're going through. This is a widely studied phenomenon, this anxiety before a medical test or a doctor's appointment. And knowing that there are ways to cope with these feelings to make some of these experiences feel a little less overwhelming. So similar to Scanxiety, white coat syndrome, which sometimes is known as white coat hypertension actually, is a little more specific. It's a condition that occurs when your blood pressure reading is higher at the doctor's office than it is in other settings, such as at home. Let's say you're someone who takes it at home pretty often, or maybe has it taken at cardiac rehab or with a doctor that you're more comfortable with. But when you go into that doctor's office getting checked, that cardiac appointment, your blood pressure is just reading much higher. And the reason it's called white coat syndrome or white coat hypertension is because healthcare professionals who measure your blood pressure often are wearing white coats. But it's talking about this idea of feeling really anxious when you're in a medical setting and that impact it can have on your body sometimes with the anxiety that you felt. So one caveat there, while white coat syndrome and the anxiety definitely may be the factor that's making your blood pressure read higher than it actually is. And because of maybe the negative or stressful connection our brain makes with that setting, depending on the experiences you have. With this specifically with blood pressure, of course, that could also be an underlying condition or a health issue. So it always is really important to get further medical workup if that specific issue is happening. But it can definitely be from the stress and anxiety. And I have worked with clients in private practice before who have this experience. They take it at home and it seems really stable, but the second they walk into that doctor's office, they feel really anxious and nervous about what they may hear, what news they may get, and their blood pressure always reads higher there. And so that's what this white coat syndrome means, which connects to that Scanxiety. So what are some of the reasons you may be feeling anxiety or apprehension before a doctor's appointment or a medical test, or while you're at the doctor's office or a hospital? So sometimes there are positive feelings of anticipation associated with going to an appointment. And hear me out here. I know that can feel really overwhelming to go see the doctor, especially about a cardiac condition. But sometimes there is some hope or optimism or excitement that you're going to get news about restrictions being lifted. Maybe you're in recovery from something happening to you. Maybe it's comforting when you go and see that doctor, if it's one that you trust and have a good relationship with, that you'll hopefully get more information, have more answers. If it's someone that you feel really confident in and trust, it can just feel really good to connect with them and see them face to face and get an update on how you're doing or some reassurance that things are okay and stable. Or maybe you're hoping to get a clear answer of where you are in your recovery process or in the maintenance of your illness, depending where you are in that trajectory. Or maybe you're earlier on in the process and have just recently been diagnosed and you're waiting for more results or more clarity. So sometimes appointments can have a lot of hope associated with them because you're hoping that there will be a clear plan of treatment. So, just thinking about some of these positive outcomes can feel comforting and reassuring, especially again, if you trust your doctor. But excitement, and even if it's cautious excitement, can feel really similar to anxiety. Excitement and fear and anxiety can be really close together and have some similar symptoms and feelings that you have. So let's think about that, what it feels like when you're excited, maybe a little nervous too, maybe both, maybe that unsettled stomach feeling, maybe your heart's racing a little bit, maybe you have some tightness in your muscles. It can feel really similar to be excited and anxious. And while there are some positive things associated maybe with going to the doctors or thinking about going to the doctors, there's a lot of distress associated with all of this too. So before I get into talking about the anxiety itself and give you a little more education about the anxiety process, and then some tools to manage anxiety. Let's talk about the emotional piece of what's happening here before or during a medical appointment. You may be feeling really scared. You may be feeling really vulnerable, really out of control or powerless, really helpless. Sometimes even a little hopeless. Maybe you've been to an appointment and haven't gotten such great news in the past, and it's hard to hope that things will get better, that you're going to get a good update. Maybe feeling a little bit down, because all of those things, of course, really impact your mood. And how could they not? This is an overwhelming process. Some people that I work with say they just feel really sad as a doctor's appointment approaches, thinking that they even have to go through this, like going to appointments and getting checked and tolerating the uncertainty that comes with that and the waiting that often comes with that. It's really, people feel really sad sometimes knowing that that's part of their life and that that's something that they can cope with more on a regular basis. But as that appointment approaches, they're really feeling that again. A lot of people, have had previous appointments where they were disappointed. Maybe news that you got either wasn't great news or wasn't news that you were hoping for or expected, or maybe there wasn't news at all. Maybe there's just still a lot of uncertainty and you're being told that you have to wait more and not know, and we'll have to see how things go. And that's really upsetting sometimes too, and frustrating. Maybe you're feeling frustrated with the way your medical care has been handled in general, either with how communication or lack thereof has been with the team. Maybe appointments sometimes have been postponed or canceled if something's going on with the doctor, and that's really hard then to have to wait even longer to get results or even get the test in the first place. I know that can cause a lot of frustration and fear. Maybe it's hard to get in touch with the medical team or your doctor when you're not there. And so you're finally getting to this appointment and there's been so much buildup waiting to get some FaceTime with the doctor and get some answers. And there's a lot of fear that comes with that as it's approaching. Maybe you aren't given a lot of instructions or information or clarity about what to expect even in the appointments, and you walk away still feeling kind of unsettled and unsure of how to navigate things and have to wait till the next appointment to have a really long conversation again. Some people aren't given much time at the appointment and feel like the doctor isn't giving them the time of day. And maybe there were some appointments where your doctor, again, tried their best and gave you some time and attention, but again, they don't know or don't have answers for you. And that's really nerve-wracking to walk out and not feel like you have more clarity when it feels like there was so much writing on this appointment or this test. So if you've experienced any of that, there's likely a part of you that is expecting again to be disappointed or upset or frustrated or scared or annoyed or feeling hopeless after another appointment or test coming up. And these kinds of worries and thoughts cause a lot of anxiety. We've made this association with a doctor's appointment or medical test through maybe some negative or frustrating experiences, that again, that's how it's going to feel when you get there and when you leave. And so that builds that anxiety beforehand as you're approaching the doctor's office, as you're waiting for that appointment, as days are going by and you see it on your calendar. And this is what we call anticipatory anxiety, which is really common for a lot of us in different, contexts of our lives, anticipating something and worrying about how it will be. And especially, again, if you've had a negative experience in that setting or in that circumstance. A lot of times, the thing that we're worrying about isn't as bad as we thought it would be, or it is as stressful as we'd anticipated, but we're able to cope with it better than we thought we'd be able to. So on top of all this uncertainty and this fear and this waiting and seeing, your body also stores these implicit memories. So when you have an experience that feels traumatizing or scary or unnerving, and you feel that anxiety in the moment, your body stores that too. It's not just your brain that stores that. And so then when you're going back to the setting or getting ready to go back to the setting, that's what a lot of this Scanxiety or this anticipatory anxiety comes from. It can be triggered just from thinking about or anticipating the appointment or being there. Maybe you get to the waiting room and suddenly you feel really anxious and overwhelmed. Maybe you're already in the doctor's room and you're waiting for the doctor. Maybe they even already took your blood pressure and went through their checklist of asking you how you are with the medical assistant, and then you're waiting for some time, which I'm sure you've all experienced too. And maybe that's when you really feel it. This can come at any of these stages before, during, or after a doctor's appointment or test. So for those of you who identified with what I described earlier of maybe usually being able to cope and for the most part can just kind of put it away, or it's something that's there and you think about, but you're used to it. And then suddenly this appointment or test is coming and you feel this anxiety really heightening. This is why all of this is going in there. You don't even maybe realize or explicitly think about how much there is leading up to going to an appointment or a test. So that's part of why I like to talk about terms like this and give you the language and just help you understand what's happening. And I hope that in thinking about all of this, you realize how normal it is to feel anxious before and during this process, going in and getting a checkup and not knowing what you're going to hear, what you're going to learn about your body and about your recovery. So let's talk about how to handle the emotional piece of this. And then we'll talk a little more about the anxiety, both what you feel in your body and also some of the thinking and how to combat that a little bit. So how do we respond to our emotions? With everything I just shared, first of all, the first piece is just acknowledging that this is real and this happens for a lot of us. And I hope after tonight and getting a little more language and a little more context about what you may have experienced many times before, but didn't really pay much attention to, is understanding why you feel this way. Understanding, again, that it's common and appropriate and having this name for it. So let's say days or weeks before your appointment, maybe hours before, or a medical test that you're getting, a stress test or an MRI or an X-ray, you notice you're feeling a little more on edge during those days and weeks leading up to it, more nervous, maybe more irritable, maybe feeling a little less patient with people in your life or things going on, the normal stresses that you can cope with usually a little bit better. Maybe you're feeling that anxiety in your body. Maybe you're not sleeping as well. Maybe, even a step farther, you're starting to think about worst case scenarios. What if I get bad news? What is this going to mean for my future? However you're experiencing it, acknowledging it, just paying attention to it, naming it, noticing what you're thinking, how you're feeling. And then by doing this, you can try to respond to yourself in a way that's supportive during this, or talk to a loved one or a friend and get support from someone else. So that may sound simplistic, but noticing and paying attention and then identifying and acknowledging a feeling such as anxiety can be a really powerful tool in itself. Say it out loud or to yourself or to someone else. I'm feeling really anxious about this appointment coming up. I'm scared that I could get bad news. I'm worried about this being a frustrating experience like one I had in the past. Just acknowledge it. Pay attention to it. This is true for any emotion, not just anxiety. It may seem easier to just push it aside or ignore it or distract yourself, maybe tell yourself you shouldn't be feeling this way. Maybe sometimes even judge yourself or feel frustrated with yourself for having a tough time as you're getting closer to this appointment or this test. A lot of us don't want to face our emotions, or maybe don't even really know how to identify them, let alone express them and respond to ourselves in a supportive way. It's uncomfortable to really think about what's going on here, to think about how scared you may feel or how vulnerable you may feel. Some people worry that giving into an emotion or letting an emotion really come to the surface, then that's going to control you and you're not going to be able to handle it. I hear a lot of people say, well, if I really think about how sad I am or how scared I am, I'm just going to fall apart. I'm not going to be able to get through the day or the week. And while I understand that fear, whether you want those emotions to be there or not, they're there. And so what happens is, as you try to suppress or fight or control these emotions, it doesn't make them go away. They're just going to come out in different ways. They're going to manifest in anxiety and irritability and sleep problems. They're still there. They're just going to come out differently when you don't really acknowledge them and address them. And then this other piece that I think is true for all of us to some extent is then sometimes judging how we're feeling frustrated or annoyed at ourselves, that we're having a hard time. That's just adding another layer to it, which makes it even more difficult to cope and can sometimes even heighten the emotional experience. So with this in mind, after noticing and acknowledging this, try to practice some self-compassion, some self-nurturance, some self-empathy. Another way I like to think about this, which again may sound kind of simplistic or for younger children, but it's really true. And I think a lot of us don't do this. Think about what you'd say to a friend or a family member if they were going through what you're going through. We're all much harder on ourselves than we are on other people. What if a friend or a family member had some kind of medical issue and they had an appointment coming up and they were just having a really hard week and feeling really overwhelmed? Would you tell them to stop being anxious, or that they're overreacting, or they should just go about their day and distract themselves and ignore it? Or would you be compassionate and be patient and empathetic and sort of validate this for them and allow and support them to feel whatever they're feeling and acknowledge how hard this is? This is what we need to try to do for ourselves. Maybe write it down. Some people like journaling, maybe say it out loud or talk to someone about it. Just put it out there, instead of trying to ignore it again or control it and then having it come out in different ways. We're all hardest on ourselves and put pressure and expectations on ourselves to always be able to cope with things in a way that we would never expect other people to. So that's the emotional side that I think is really important to think about as you're going through this. And let's talk now more about the anxiety, the Scanxiety, which is, I guess, the crux of all of this and of this presentation more specifically. I like to give a little education about anxiety. I think it's helpful to just understand what's happening in your brain and in your body when you're anxious. The first thing, though, that I like to tell people about anxiety, as much as it's uncomfortable and it's unpleasant and it can feel really overwhelming, it's temporary. Anxiety, the feeling of anxiety is temporary. And I know that hearing that, some people may say, no, I'm always anxious. I wake up and I just feel overwhelmed, especially maybe these days or weeks leading up to an appointment or a test with the doctors. My stomach's always in knots. I always feel uneasy. But there are moments where you don't feel quite as overwhelmed, quite as anxious. Anxiety itself is a temporary feeling in that it's something that you can tolerate, and distress tolerance, as hard as it is, in moments where you're feeling really overwhelmed or almost panicky, it's important to remind yourself that I will not always feel this anxious to this extent. In that way, it is temporary. So there are two different pathways to anxiety. There's what we call bottom-up anxiety, when you're feeling it more in your body, and then the top-down anxiety, kind of your thoughts and the worries, and sometimes we ruminate, kind of thinking about the same thing over and over. So I'm going to talk a little bit about both separate types of anxiety and give some techniques for coping with both. So this bottom-up anxiety, your body. So I want you to think right now, think about what you feel in your body when you're anxious or stressed or overwhelmed. What does that feel like in your body? What's that somatic experience? Some people, their muscles tense up. Some people, their heart rate is suddenly really quick, or their breathing's a little more shallow or rapid, or you feel this tightness in your chest, or your stomach is upset. Some people, when they get nervous, suddenly have to go to the bathroom. They didn't really need to go, but suddenly there's this urgent feeling. Everyone experiences this differently. But what's happening on the most basic level is that your brain is sensing a threat when you're anxious. And that threat activates this part of your brain called the amygdala. You have two amygdala that are small, almond-shaped things in your brain, one on each side. And this is the brain's alarm system. So this alarm gets set off, and it sends a signal down to your body telling it that there's danger, there's a threat. And this activates part of your nervous system called the sympathetic nervous system, which is telling you to get ready to prepare for danger, for a threat. And so some of you may have heard of that fight, flight, or freeze response. That's what this is. It's that part of your nervous system that's getting ready to fight or flee or sometimes freeze when there's moments of danger or threat that are being activated in your brain and your body. So what the body is doing is getting you ready to respond. This is a primitive biological protective mechanism in our brains. And while this has gotten much more complicated in modern day, think about kind of cavemen back in the day needing to protect themselves from a predatory animal. They didn't have time to think about the danger. They saw that animal that could attack them or kill them. They needed to quickly and instinctively react to get to safety. And this part of our brains was helping them to do that, keeping them safe. That reaction, there's a threat, there's a danger, sends that signal down to your body. That heart starts racing, your muscles get tense. Kind of the urgency feeling is sort of getting everything out of your body, making you lighter. That's what's happening there. And the problem is our brains, coming back to the present day, don't know the difference between actual danger and perceived danger. It's the same process happening with anxiety, still activating this part of our nervous system, making you feel all these physical symptoms. And this alarm, this amygdala, can be triggered by a thought. It can be triggered by a memory. It can be triggered by going to a certain place, like a doctor's office or an MRI machine or an X-ray room, or maybe even cardiac rehab, where you had a negative or difficult experience. And then you feel this anxiety in your body. It's just got triggered because your body sensed a threat. There's a danger there. I had an experience here that was scary to me, or I'm even thinking about this doctor's appointment, and suddenly you feel it in your body. So this is often what we're experiencing with this idea of Scanxiety or white coat syndrome. Your brain and your body are trying to protect you, But I know that does not feel good a lot of the time, and it's the same anxiety response. So when we think about this in the context of what you may be going through, and coming back to this topic tonight, in these environments where you have gone through some trauma, or you've been given some tough news or a diagnosis, or told there's new limitations and restrictions on your life, when we think about even or get ready for going to that appointment, it makes sense that this is getting triggered. Maybe even when you call to schedule the test, or when you see it on your calendar when you're going through the week, or when it's getting closer. What's happening during these days and weeks before too is your brain is maybe hypervigilant, always sort of assessing for threat, because you're always worrying about what this is going to feel like for you and what's going to happen. Always a little uncertain and fearful. So then this alert is always on in your body and your brain. And so that sympathetic nervous system, that fight, flight, or freeze response may sort of be in overdrive during that time. And just think about how exhausting and draining that is, to just always be ready to go, ready to fight or flee. That's a lot of what's happening those days and weeks leading up to this appointment. So how do we cope with this? The problem is this part of our brain, the amygdala, it isn't a logical part of our brain that thinks critically. It's more responsive, it's reactive. That's why it happens so quickly. You may, in one of these contexts, feel it in your body before you think about, okay, what am I anxious about here? What am I worrying about? That response already got triggered. That activation already happened by the time the rest of your brain, the more critical, logical part of your brain, starts thinking about what you need to do. And again, that's for a reason. It's to get used to safety. But what we need to do here with this bottom-up anxiety is we need to bring down that arousal. We need to quiet that alarm. We need to send a signal to our brain that we're safe right now. And we do this by grounding ourselves. We need to come back to the present moment and be very mindful of the here and now. So I'm going to introduce you to a few techniques that you can use in moments when you notice these symptoms in your body. And what I want to recommend, what's really important, just like paying attention to your emotions, is kind of paying attention to what this feels like in your body and noticing those warning signs that this anxiety response is getting activated. Some people, I use this example of my mom when she's getting tense or getting mad at me. She feels like this tension in her neck, and I see her start going like this. That's the first sign she gets. Her body's getting kind of prepared. And so maybe she's on that full-fledged anxiety response with her heart racing and all of that yet. But for her, that's a warning sign that she's starting to get activated. So you want to use one of these techniques when you notice the warning signs before you're in that full-fledged, overwhelmed panic feeling. So think about what those warning signs for you, and when you notice and feel in your body that you're feeling anxious or overwhelmed or stressed, start paying attention to what that experience is like for you. I always share this when I'm here, when I'm talking about this. I get a little nervous before public speaking, even on Zoom here where I can't see you. And right before I sign on, I kind of feel my heart start to race. And so I know what's happening in my brain that's causing that response in my body. But telling myself it's fine, presentations always go well, I calm down. Once that's activated in my body, that doesn't make my heart stop racing. That doesn't change what I'm physically feeling. It doesn't really slow it down. We need to use one of these other techniques that are grounding ourselves and sending that signal to our brain that we're safe. So I'm just going to teach a couple, just being mindful of time so we can get to the top-down thinking part of this, which is a lot of you experience a lot, especially with this topic tonight. Just some discrete, simple ones that you can use anywhere that people aren't really going to notice. And again, I apologize if you've been here before. These are going to be somewhat repetitive, but I like to pick a couple that I think are just really user-friendly and can be used anywhere. So we think about the idea of mindfulness. Mindfulness is just being really aware of the present, not judging how you feel, but being aware of it, just kind of noticing, observing, allowing yourself to feel exactly how you feel. Trying to be relaxed and trying too hard can make you feel more stressed. So what we're trying to do here is just kind of bring that down and notice what's going on for ourselves and respond in a way where we're telling that part of our brain that we're safe. So the biggest one here, is taking deep breaths. And I'm sure you've all heard that before. The breathing's helpful for anxiety. But after understanding more about this anxiety response in your body, I hope it makes sense why. Because while none of this changes the circumstances of what's going on that's causing you stress, there are MRI studies of the brain that have been done that show the amygdala arousal decreases with deep breathing. And that's going to then activate the other side of your nervous system called the parasympathetic nervous system, which we call the rest and digest mode. It's sort of the other side when it's balancing out like this with that sympathetic side, that fight or flight side. That's what we're trying to activate here. So a few things that are helpful with breathing, you're focusing on the breath, first of all, which is going to help you be more present and help you focus here instead of whatever's going on up here that's causing what's going on down here. The other thing that's important to note is a longer exhale is what activates that sympathetic nervous system, the parasympathetic nervous system, I'm sorry, that rest and digest mode. It helps maintain a healthy level of carbon dioxide in your blood. It's just going to help you relax. So a longer exhale, whether you use the one I teach you tonight or just take some deep breaths on your own, that longer exhale is activating the side of the nervous system that we need to start to relax a little bit. So when we are anxious, we often breathe more rapidly, a little more shallow, really more in our chest. And so this breath that I'm going to teach now called diaphragmatic breathing, or you may have heard it called belly breathing. This is taking a deeper inhale and trying to send the air down to our bellies, to our diaphragm. And that's to slow the breath, activate the side of the nervous system that we need for rest and digest, tell our brains that we're safe. We're just trying to slow it down a little bit. So I'm going to have you try it with me and place one hand on your chest and one hand on your lower stomach area under your belly button. And let's first just notice which hands are rising and falling. Yeah, I disclosed right now that presenting makes me a little nervous. My top hand's rising and falling a little bit more. My breaths are probably a little bit more shallow, a little more rapid. For a lot of us, that's how we breathe and how we notice our breath, not so much that bottom hand. So what we're going to try to do with these breaths is push the air down into that bottom hand. Imagine there's a balloon underneath your belly button that's rising and falling with each breath that we're inflating and deflating. This can feel a little weird at first. This takes practice, but we're going to try a couple tonight. So I'm going to count you through them. We're going to inhale for 4, hold for 3, and exhale for 6. Longer exhale. And just trying to push it down into that lower hand if you can. And something that I like to note too for that mindfulness piece of it, focusing on the breath. Notice when you're doing this, when you're inhaling through your nose, that the air coming in is cool. And then when you exhale through your mouth, the air coming out is warm. And this is, again, just being intentional in the breathing, being mindful, paying attention. So I'm going to have you try it with me if you want to close your eyes or lower your gaze. And first, just do a quick body scan for a moment. Kind of roll your shoulders back. Pull them forward. Notice how you feel. Is there any tension in your body? Maybe you've been sitting a lot of the day. Maybe you've been running around a lot of the day. We hold a lot of tension in our neck and upper back and our shoulders. Just notice how your body feels before we take these couple breaths. I'm going to count us through 3. Remember, inhaling through your nose, exhaling through your mouth, trying to get that air into that hand that's on your belly. So let's inhale for 4, 3, 2, 1. Hold for 3, 2, 1. Exhale for 6, 5, 4, 3, 2, 1. Again, inhale for 4, 3, 2, 1. Hold. And exhale for 6, 5, 4, 3, 2, 1. One more. Inhale for 4, 3, 2, 1. And exhale for 6, 5, 4, 3, 2, 1. Now just let your breath return to its normal rhythm, trying not to control it. Notice now again, take a moment just how your body feels. Is there any tension that kind of left your body or calmness that you feel a little more than before? You know, that was only a couple of breaths, and this is something that takes practice. Maybe that long exhale felt kind of weird and unnatural. Maybe pushing the air down into your diaphragm felt strange. If you ever wanted to try this and wanted someone to lead you through this, you can look it up. There's a lot of videos on YouTube that could lead you through a diaphragmatic breathing or belly breathing. And the more you practice that, the more you're going to feel comfortable using it, not needing to put your hands there. I did that tonight just to help you get a sense of what you were feeling before and after. Okay. So another mindfulness technique that I really like is one where we focus on our 5 senses, and it's called the 5, 4, 3, 2, 1. And I taught this once here as well. So again, you're sort of overwhelmed. You're either scheduling the appointment, you're getting ready for it. Maybe you're in the waiting room. Maybe you're already in the doctor's office, whatever it is, you're starting to notice this anxiety in your body. What we're doing with this technique is we're refocusing on the small details of our surroundings in the present moment. We're safe right here in this moment. We're bringing our brains and our minds back to right here. So we're going to work through, I'm going to do it as an example here, the 5, 4, 3, 2, 1. So we start with, what are 5 things that you see? Simple things. And through each of these, I like to ask you to think about 1 or 2 adjectives to describe each, noticing the details. So I see my table here, and it's wood. I see a plant, and it's green. I see the TV, and it's off. I see my water bottle, and it's blue. And I see my pen, and it looks almost empty. Just look at each thing. Do this maybe in your own room right now. 4 things that you feel. I feel my sweatshirt, which is very soft. I feel my hair. I feel my fuzzy slippers underneath the table. And I feel the table, and it's smooth. Now, 3 things that you hear. I hear the cars going by outside, reminding me I'm in New York City. I hear the clock ticking in the kitchen. And I hear the dishwasher running, and I hear the water swishing around. Just paying attention to the sounds for a moment, small details. 2 things that you smell. These are a little bit harder sometimes. You can get creative. I smell my dinner that I had before, and I smell my hair. It smells like my shampoo. And 1 thing that you taste. I'm going to take a sip of my water. I taste my water, and it tastes good. So the 5 senses: see, feel, hear, smell, taste. And let's say you're in the doctor's office and this feels more stressful to you to notice all the things that you're seeing in there. Do it more as an imaginal exercise. Think about your room at home and work through this for yourself, kind of imagining all of these things. You can do this with imaginal as well, and they can work. And the last one I'm going to teach about this bottom-up anxiety for a technique before we move on is this peripheral vision one that I taught once here and people really liked. So thinking about that nervous system, that sympathetic nervous system, you sensed that threat, that signal got sent down to your body to get ready to go. What happens with your vision is your vision's really acute, right? We're preparing for this fight or flight. My vision's really acute in front of me, getting me ready to protect myself. So with this one, when we're trying to focus more on our peripheral vision, it forces a relaxation response in your brain. It activates that other part of the nervous system, the parasympathetic, that rest and digest. So this is a simple one that can be really done anywhere, and it's quick. I'm going to ask you all to look ahead, maybe above the screen or to the side, and focus on a spot straight ahead of you. And just look at that spot for about 5 to 10 seconds. Just notice what it looks like. Really focus on it. I'm looking at my ring light. It's across the room. And keeping that focus, I want you to widen your field of view, not looking away from that point. And notice what you see in your peripheral vision. So let's start on the right side again. Keep looking at that point right ahead. Notice what you see, a few things on the right side in your peripheral vision without moving your head or your eyes. Maybe notice some colors. Maybe something's moving over there. Maybe you notice some objects or some furniture. Still looking ahead though, still focusing ahead. Just widen that field of vision to the right. And now to the left. Notice what you see on the left in your peripheral vision. A few details of each thing. Just try to look at that for about 10 seconds. This technique, again, is simple. It's discreet. You can do this in the waiting room at the doctor's office. You can do this any moment in the days or weeks before when you're feeling anxious and you're noticing that coming up for you. People aren't going to notice you're doing this, and it's simple. But even right now, even walking you through that when I did it myself, I feel a little calmer. My heart rate's come down a little bit between the breathing and this. Just notice how that feels and just practice that a little bit. So that's one part of Scanxiety, what we feel in our body. Yes, Ray.
So we do have a question that came in from one of our listeners. And the question reads, how long would a diaphragmatic breathing session be to relieve stress? 3 minutes, 5, 10. What do you recommend?
I think it's not about how many minutes. I think 10 would be a lot. I think it's practicing and seeing how many breaths feels good for you. You don't want to be controlling your breathing like that. I wouldn't say for 10 minutes personally, although it is very personal. What I would do is start with 3, try 6, try 10 breaths, see how that feels for you. You're going to have to sort of experiment with that and see what helps you really relax and calm down. Some people like longer practices, breathing practices. I personally like ones that are a little more brief. I feel like I can concentrate on those more and really focus on the breath. But I don't know that there's really a suggestion, because I think it's really personal what feels good for you. And I would have you practice it daily if you can, and kind of play with the time and how long it works. Daily practice of diaphragmatic breathing or any mindfulness exercise is really important, because then you're going to feel like you have access to these tools when you're in moments of distress. So let's say you are really stressed and this is when you're implementing it. You may only want to do a couple of breaths. You might feel really overwhelmed in that moment. But maybe a different day in the morning, let's say you're kind of preparing for the anticipation of the day and you want to just take some breaths to get in the practice of doing that. You'll have to kind of play with that and see what feels good for you. But I think even a couple breaths can have a positive impact on this anxiety activation in your body. So I don't know that anything's too short. I think it's always useful. But for how long to do it for, I think that's really personal and what feels good for you. So I know that's not an answer that really gives you an answer, but that's how I feel about it. So if there aren't more questions about that, I do want to make sure we have enough time to talk about that top-down anxiety, the anxiety that comes from our worrying, from the thoughts that we have. And we all experience this to some extent with all different areas of our life. But when we're thinking about what we're talking about tonight, it can be these racing thoughts, these what ifs, these worst case scenarios. Maybe you get in bed at night when there's no more distractions from the day or stimuli. And all these fears and these worries feel like they're suddenly impossible to ignore, like you could during the day. And thoughts tend to spiral. They tend to build on themselves. So these what ifs could start with, what if I don't get great news at this appointment? To what if this means I have limitations in my life? What if this means I can't work? What if this means I'm going to be miserable? What if this means I won't enjoy my life? These thoughts sort of build. We kind of start with one place and it gets to this place of worst case scenario. Sometimes it's less specific thoughts, maybe just overall feeling of uneasiness, maybe that rumination that I mentioned earlier, which means worrying about the same thing over and over, never feeling better about that thing because we just keep going over it and over it. Some people use the word obsessing there, which I don't love, but maybe that resonates with you. That's what ruminating means. And with all this, we can't control the thoughts that come into our heads. What we can control is noticing and paying attention to them, just like with our emotions, just like with what we feel in our body, and being mindful of these tendencies and thinking patterns that we have. We can control how we then respond to them, how we maybe reframe and reevaluate our thoughts, and how we challenge them. So with the techniques to cope with this top-down anxiety, this might be for the anticipation phase before an appointment. It might be when you're in the waiting room or when you're waiting for the doctor or technician for a test, or maybe afterwards when you're home and you're waiting for results or waiting for the next appointment. So, the first step with any of this is notice and pay attention to what kind of thoughts cause distress for you, kind of separating yourself from your thoughts a little bit. You want to sort of recognize and name and acknowledge, I'm having an anxious thought. And that in itself sometimes can be a really powerful tool to just stop it in its tracks before it builds. So start paying more attention to the thoughts that cause you stress. Notice there are often patterns in them. You want to catch them. You want to respond to them differently or respond to them at all. Sometimes we don't respond to them at all. We just let them build. We kind of sit there in this anxious thinking pattern. What you're doing here is trying to take the power away from the thought before it causes this extreme anxiety response. So when we think about challenging our thoughts, we can ask ourselves some questions in response to these anxious thoughts once we realize we're having them, once you notice you're worrying about something. Trying to think a little more critically and a little more logically and sort of poke holes in the thoughts. A lot of times when we're thinking about these things, especially, thinking about our health and some very real and valid fears, we feel really emotional. It can be hard to rationalize with ourselves. So in challenging the thoughts, we want to ask some really logic-based questions, such as, is my thought based in fear or in fact? And I know that's a tricky one with health, and we don't necessarily have the facts, and sometimes there were facts that caused these fear, but a lot of times the thoughts that we have are fear-based. You don't know yet that you're going to get bad news. You don't know what this means for your life. You don't know that you're not going to be able to adjust and still have a meaningful life. It's based in fear a lot of times. So even asking yourself that, is my thought based in fear or in fact right now? Do I have evidence to support this, even taking it a step further? And this is that cognitive behavioral therapy that I mentioned before. Do I have evidence to support this? I don't love this, but some people will say, would this hold up in a court of law, this thought? Is there really evidence to support this fear that I have right now? Another question, how likely is this to happen? Oftentimes we overestimate how bad something's going to be. Am I overestimating how likely this is that I'm going to get terrible news and then it's going to mean all of these what ifs? Another thing that I think is really useful that I work on a lot with my clients, maybe what you anticipated does happen. Maybe you get some news that's upsetting or disappointing or does have an impact on your life. But the question to ask, am I underestimating my ability to cope with this? Have I coped with hard things before? Have I adjusted? Do I have supports in place? Maybe I'm overestimating how bad this is going to be, and maybe I'm underestimating my ability to cope with it. Sometimes this can be a tricky one with health too. Sometimes going to that worst case scenario is helpful. Let yourself think about that for a minute. Can I handle it if I get this worst case scenario news, whatever it is that's really that underlying fear causing this anxiety? Similar to what I brought up with emotions, what would I tell a friend if they were thinking this way and they were worrying? We can give really good advice sometimes to friends and family that we don't give to ourselves. Someone was coming to you and they were feeling really anxious about something in advance, a doctor's appointment. They were thinking of the worst case scenario. They were overestimating how bad it's going to be. What would you tell them? You'd probably try to reassure them a little bit and tell them to just wait and see, and hopefully things will work out. You try to be hopeful. You're doing this for yourself sometimes can help when these anxious thoughts are coming up. Another one I really like, have I had anxious thoughts like this in the past, and what's happened? Was my anticipation worse than what actually happened? Was I able to cope with whatever news I got? And then the one that I really like, these are all ideas of different questions, and I know I'm throwing a lot at you, but certain ones stick with people more than others. One that I really like for myself when I'm anxious, is this thought serving me? Will worrying about this right now change the outcome of what's going to happen? Or is this just making me miserable and anxious right now? And again, I know that doesn't take away from the fear and the fact that there is a possibility and there is uncertainty that this, whatever you're worrying about, could be true. But thinking about it right now is not serving you. It's not going to change the outcome. And even sometimes just asking yourself that in that moment, when you recognize this thought, can just kind of stop it in its tracks a little bit. You're challenging the thought. You're taking a step back from the thought. So with this, we want to be aware of these patterns that we have in thinking. We tend to worry about the same kinds of things or in the same kinds of ways, and our thoughts are not always factual. And more so than that, we often have these certain thinking patterns that are really common. So I'll tell you about a couple of them that are really common and some words you probably heard before. Catastrophizing. I love that one. That's one that my parents used to say to me when I was younger, you're catastrophizing right now. I think that's one that's a little more common language. And it means exactly what you think it is, blowing things out of proportion. Sometimes I hear something or I worry about something and suddenly I'm suddenly in this place of no return and I'm just totally blowing it out of proportion really quickly. It just happened quickly. I'm catastrophizing. I think even that word, just even saying that to myself sometimes, it does sort of stop it a little. I even see Frank laughing. You want to find a little humor. Sometimes our thoughts can really get away from us. And when we indulge in them and sort of let them keep going and spiraling, that's when it causes so much anxiety. And this is not to invalidate at all how any of you are feeling. This is very real, but we can make the process of waiting and coping and adjusting a little less overwhelming by doing some of these things with ourselves, gaining insight into how we think and what makes us feel anxious. Hand in hand with catastrophizing is jumping to conclusions, that worst case scenario. Literally think of yourself jumping there. That happens. I have an appointment. Oh, this means for sure that I'm going to get terrible news, or the receptionist sounded a little weird on the phone, or the doctor wants to see me sooner or see me later. And you just jump to that worst case scenario. You jump to the conclusion. Again, that's based in fear. That's not based in fact. We don't have the fact yet when we're anticipating. Or overgeneralizing is a really common one. Well, this negative outcome happened, or the situation happened before, or last time I went, it wasn't great news, or last time I went, there was no clarity and I walked out and didn't necessarily have a treatment plan or a sense of what my life's going to look like or where my recovery is going to plateau. So that means it's going to be like this time. That means this appointment, I'm going to walk out feeling this way. You're overgeneralizing based on something that's happened before. And while again, that's really normal, and that's part of what happens in that really automatic way with the anxiety response in our body, when we're thinking about the cognitive piece, the thoughts themselves, we can rationalize with ourselves a little bit. I'm overgeneralizing here. I'm jumping to a conclusion. I'm catastrophizing. Another big one, and these all are a little bit similar, is negative noticing. We tend to remember and draw on the negative instead of thinking about positives. And we all probably can relate to this, whether it's about health or something else. You remember the times that were really scary or really upsetting, or the big fight that you had with somebody. That's what sticks out in our memory. Of course, those are the things that really impacted us more than the small moments that felt good. But we have to challenge that negative noticing. What things have gone well? Were there moments when your doctor told you something that felt reassuring? Were there times that you coped despite a stressful situation, or you really connected with someone and it felt really good and really supportive? Were there interactions that were supportive from the medical team that felt comforting? Were there moments of hope for me? Paying attention to that, being mindful of that in the present, but also in these moments of anxiety and distress as you're waiting for an appointment, try to draw on that a little bit. Don't just remember the news that was really tough. Of course, that's going to stick in your mind more, absolutely. But try to remember the positives, focus on the positives, not just notice the negative. And the last cognitive thing that I think is really important is managing expectations a little bit. And this can be really hard to think about and may actually cause more anxiety in itself, even right now as I talk about it. So I apologize for that. But I think it's really important as you're preparing for a doctor's appointment or a test or an exam. You may not get answers you want, and there may be more waiting or more uncertainty that you have to tolerate, or some disappointing news, or some restrictions or limitations that you have to continue with, or some medications or treatments that you need to keep doing, or new ones you need to start. And that's all really hard and may sound like the opposite of everything I'm talking about tonight, but sometimes thinking about that a little bit is important, sort of managing and preparing yourself for what might happen in that appointment and letting yourself go there a little bit and trusting that you can cope with it. And I think a way to cope with this piece of it is to think about what you can control. I know there's a lot you can't control. I know a lot of what I just mentioned feels like you can't control and feels really scary, but there are things that you can control. And sometimes empowering yourself in that way and kind of grasping for control in areas where you have it can feel really useful as you're dealing with this Scanxiety. So what are things you can do? You can make lists of questions that you have for your appointments. When you have something you're worrying about, write it down. That in itself is helpful because you're kind of getting it out of your head onto paper, but knowing that you're prepared and going to address it with the doctor. Maybe you won't get the answer you want, or maybe there won't be an answer yet, but make the list of questions. Write down what you're worrying about or what you're thinking about. Wanting to be a key participant in your care. Maybe bring someone with you that you trust to ask questions to, or hear the answers with just another set of ears. Because when we're really emotional, it can be hard to think clearly and logically or be articulate, even if you're prepared. Think about the doctors you're working with. Do they feel like a good fit for me? You are allowed to change doctors if you don't think the personality works or their style doesn't work. That matters. That's going to add more distress when you're waiting to go see someone that doesn't make you feel great when you go see them. You're allowed to change doctors. Making time for pleasure is really important. When you're going through this and you're feeling stressed, especially those days or weeks before an appointment, it may be hard to even want to or be interested in doing things that usually feel good and give you joy. But this is really important for your mental health and for coping with this anxiety. And with that, having some routine, some normalcy, some things to look forward to, some structure in your day and your week when this all feels so overwhelming and scary. These are all things that you can control that are really useful when you're going through this. So those are some strategies in general. And I hope that hearing all of this and knowing how normal this is and that there are some ways to try to cope with it and make it feel less overwhelming is comforting to you. But look up these terms if you'd like. There are articles on them. I think thinking about anxiety in general is really useful, but the Scanxiety, which is the specific anticipation before a doctor's appointment, it's very real and it's very hard to cope with. And just all of this is about how to take care of yourself in that, how to support yourself in that. So I hope that it was helpful to talk about it a little bit more. And that's all I've got for you.
Rachel, thank you so much for your time tonight and your presentation. I do think a lot of this information you're sharing with us is practical exercise tools we could use anytime. I know I've used them in the past. Um, if there are any questions from anybody right now that you have, please submit them. We still have maybe 5 more minutes. Otherwise, if not, a lot of these, well, all of these webinars we've been recording will be soon placed on Mount Sinai's YouTube channel. Right now, we're working those details out. So for everyone who has been wanting to see these webinar presentations again, they will be placed on the Mount Sinai YouTube channel. We'll be announcing when that's going to happen soon, but we'll let you know for sure. Now, if there's another question you might have that's more on a personal basis, you can still submit it in our survey at the end of this webinar. I'll send over the question to Rachel, and Rachel can try and answer you through your personal email. I'd like to conclude tonight with saying, Rachel, thank you so much for all of your help and all of your presentations. Next month, we will be having Dr. Fergus and Teresa. She's a nurse practitioner who's going to be talking about cholesterol. It's a part 2 to their previous presentation that was several months ago. So we'll have them back. And I will be presenting at the end of the month as well on a topic regarding exercise. So stay tuned for those announcements on those webinars and those topics. With that said, thank you so much for participating and joining us tonight. I hope everyone has a wonderful night. Rachel, thank you so much.
Thank you. Good night.
Good night.